Welcome to Our Scars Speak. My name is Christina Miner. I'm the host of this podcast. And before we begin, I'd like to give a disclaimer that you're listening at your own discretion. We are not being held liable for anything that is said within this interview. We're merely here for entertainment purposes, for support, for encouragement, to share our story. That's the main thing. But we're not here to give any type of medical advice or mental health advice or any type of professional advice to tell you to go with. You're definitely listening at your own discretion. So tonight, without further ado, I have my girl, Jennifer Thomas, up here tonight. I'm so excited. Yes, you finally made it. So I'm so excited. Jennifer and I met through Here for the Girls, another Here for the Girls, another boober, another calendar ambassador, all these great things that she is. And I'm so excited. She said yes to be up here. She has a powerful, powerful story. I am not going to continue to run my mouth about her because I could go on and on and on. If you've seen the video, though, the reel I did this week, she was at the dinner with me. And so yeah, we're at a lot of events together. She's just awesome person. So you. So Jennifer, I know you're so many different things, but if you don't mind just sharing with people who you are and some things you may want people to know about you, as far as your personality and how you describe yourself.
First off, I try to stay positive all the time. I've always been told that I'm always too nice, but that's okay because I'll take that compliment. And first and foremost, a mom. Everybody knows that my two daughters come first and everything. Love my career. I always strive to be the best at what I do. So yeah, and just trying to being an empty nester now, just trying to find my way now, having all this free time to myself. So
Right. It
yeah.
is a difference when they're all out the home.
Yeah.
Now you said your career. Now I want everybody, because I'll be bragging about my girl working in the prison system. So tell people, if you don't mind sharing, if you can, a little bit about what it is that you like, what you do in the prison.
I've been with the Bureau of Prisons for 18 years now. And right now I currently am a deputy case management coordinator for the Bureau of Prisons at Petersburg. I started there as a secretary, then I worked my way up to a case manager, and then now I'm the deputy CMC, which is kind of like the overseer of case management. You're kind of like the expertise, or kind of say. So I kind of yeah, and I strive to continue to move up potentials there. So that's what I want to do. Yeah.
All right. So Jennifer, I know that definitely you've gone through breast cancer, you've gone through uterine cancer. That was on your flyer that I posted. But before all of this cancer, what was life like before the diagnosis, before any of this happened? Like, how's life going for you?
It was going okay. Like I said, a mom first, and then I had gotten married like a year before that for the second time, and was kind of going through that for about a year. And before I got diagnosed, I was kind of going through a really tough kind of divorce, breakup, drama, whatever. So with that added on to that, and then finding out that I had breast cancer, it was kind of, when they say it rains, it pours a little bit. So that's what it was at that time. Yeah.
Wow. So did anyone in your family ever have cancer at all?
My great aunt did.
Okay. And
Yeah,
she had breast cancer
she
or
did. Yeah.
okay. Okay. So life was, I guess, before breast cancer, it was good, yet you were going through some of your own challenging things at the time, as far as personal things.
Right.
So when you were how, if you don't mind me asking, how old were you when you got diagnosed?
I was 38.
38. So you were young, very young.
Yeah.
And y'all, for those of y'all who are listening, if she was diagnosed at 38, she probably had it a few years prior to that, I'm sure. But yeah, if you could just kind of go into it, if you don't mind, just sharing, share your story, share how you found it, how you discovered it. Did you, were you commonly doing your self checks, or how did this all transpire for you?
Well, I really didn't do checks, regularly like I should have, but for some reason I did, in the shower, just check in and I had felt the lump. So I put it off for a little while because, you kind of be like, well, I'll get to it. You know what I mean? Like
Right.
life is kind of crazy and hectic. So I had a coworker of mine that she was like, Jen, you got to go get this checked out. Just keep, stop putting it off. So I had gone, and they had said that they wanted to get it tested, biopsy, of course. So I had the biopsy done, and they had said that it was at the end, it was I got my little cheat sheet. Invasive ductal carcinoma. So I had to get all the
Okay.
medical terms correct. So, and then after that they said it was cancerous, they tested me in my lymph nodes. So at that time, since it did go to my lymph nodes, I was diagnosed as stage 3A. It's let's see, ER/PR positive, HER2 negative,
Okay.
and stage 3A.
Okay.
So
So you found the lump, and when you found the lump, you finally went to the doctor.
I
And
did.
did they do, was it like one of those days where they like did the mammogram, they were like shocked, and then they put
Mhm.
you to go through ultrasound? Like what happened on that particular day?
Well,
Do
I
you-
just went to my gynecologist. I was 38, so at that time never had a mammogram before, because usually at 40 you get mammograms. So I went to my gynecologist, and she did, just like the self exam, and I said, hey, I said, look, I feel this right here. Can you take a look at it? And as soon as she did, she was like, yeah, we need to get that checked out. So, and she had referred me to, Bon Secures, and the doctors there. She was like, they're kind of, some of the best ones. So,
Mhm.
I went with her recommendation, because she's been in the business, a long time. So,
Right.
and after that, it just, the whole whirlwind, it started. So,
Yeah.
yeah.
So they gave you, so you went for you got your mammogram. So the same day, did they do an ultrasound when you got your mammogram, or did they wait and have
Well,
you come back, or?
well, they did the ultrasound. They didn't see anything with the mammogram, so they did the ultrasound. So it's a
Oh,
little bit, yeah. So with the ultrasound, they had seen it, and they take the pictures and stuff, and then send it, and then you go in. I went to the Virginia Breast Cancer Center, and then Dr. Pelicane was the doctor,
okay.
and they did the biopsy right there in the office. So, and then
Wow.
just had to wait. So.
So they did a biopsy the same day you had the ultrasound done?
No, after they did the ultrasound, they referred me to him, and then when I
Okay.
went to him, he did all that. So
Sorry, I'm drilling you, but a lot of people
I'm
don't know the
fine.
steps that we have to go through, because sometimes
Yeah.
some people, I've known one person, she ended up like when she had the ultrasound and everything, they kind of
Mhm.
did a biopsy. I don't know if they had time or what, because
Right.
usually you have to come back
You
and
do. Yeah.
do those steps. So when you had the mammogram, I'm
Mhm.
curious, did they tell you that you had dense tissue or anything like that? I'm trying
Well,
to figure out why they didn't see it, or
yeah,
was
they just didn't see it. So I don't know why they didn't see it, because I mean, it was about 6 centimeters at the time,
wow.
so it was pretty big. But yeah, they just said, well, we got to go in with the ultrasound and see if we can get it, maybe where it was placed. Maybe I'm not quite sure. So
Yeah, but they never say you had dense tissue.
no. Mm-mm.
Okay. Okay. Yeah. Because
Yeah.
sometimes, a lot of people think, oh, it's automatic dense tissue. I didn't see it.
Yeah.
But like you stated, sometimes it's just positioning
Yeah.
and find it.
Yeah.
So you had the biopsy done. Okay. So the phone call comes, I'm sure.
Yeah.
I'm sure you had some type of phone call or either a message
Yeah.
or something. How did all of that transpire after your biopsy?
So they wanted me to come in, and I was like, okay. And they always put you in that little room with the couch and the nice decorations, and sit down with you and say, this is what's going on. So you're kind of sitting there, you're like, okay, you're hearing it, and you're like, okay, so what do we do now? And to be honest, my first question was, when they said I had to do chemo, my first question was, am I going to lose my hair? And I know that may seem vain to some people, but it's your outside appearance, you know what I mean? So, and I always say that, not a lot of people know what's going on inside, but when you have chemo and you lose your hair, what you're going on inside is shown to the world. So
Right.
yeah.
So when you had your call,
Hmm.
they didn't tell you, did you even think at that moment that, oh my goodness, I may have cancer? Or did you kind of like, oh, they just probably want to tell me my results and go home?
Well, I say I didn't know, but I kind of knew something was wrong because they wouldn't do all of that if there wasn't something, because it was just such a rush. Like, we got to do this, and this, So
Right.
it's kind of like, okay, something's not right. Um, so yeah.
Okay. And did you go by yourself?
No, because I was married at the time. Well,
Okay,
I
so you
was
were
I
married.
was married but separated, but he did go with me and kind of was like, okay, you know, kind of supported me to some
Good.
extent. Yeah.
Right. No, because some people, they go by themselves because they're not thinking that they're going to hear that they have, cancer or whatever. For me, I was told over the phone. So I told him, tell me as soon as possible. I didn't care if it was over the phone. So
Yeah.
that was my fault. I thought I should have waited, uh, but
Mhm.
yeah. So for you, you did have support, so that's good. I mean, regardless of what I guess y'all were going through, I'm sure in that moment that
Mhm.
probably was kind of beneficial to you. I'm
Yeah.
assuming.
Yeah.
Yeah.
Of course. Yeah.
Okay. So you get the results and they're telling you, what did they tell you would have to do? I know you said chemo, but did they
Mhm.
go over everything else with you? Like, did they share any other things that you would have to go through?
Well, they said, first chemo first because they wanted to shrink the tumor. So
Okay.
they do the chemo to try to do that. And then, the doctor had asked me, do you want to do a double mastectomy or do and my thing was, yes, just take both because I don't want to go through this again. So, and he kind of made it my choice, which I felt was good because some doctors don't let it be your choice, so
Right.
yeah.
So they offered, they said you had to go through chemo first. And
Chemo
then
first.
did you have your surgery? Because a lot of people don't know the steps and why they
Yeah.
tell them to do that. So, and everybody's treatment plan's different, but
Right.
just curious, with your treatment plan, the chemo was first to shrink the
Mhm.
tumor. And
Yeah.
then was it surgery next or radiation?
No, it was chemo and then I had surgery after that.
Okay.
Hmm.
Did you have to get radiation?
I did after the surgery. Yeah.
Okay. Okay. And what type of surgery did you end up having, if you don't mind sharing?
So I did 5 months of chemo. So I did 8 rounds of the AC and then 12 rounds of the Taxol. And then I did a nipple sparing surgery
Oh,
to try to save my nipples, which um, in hindsight, I kind of wish that I didn't. I mean, you don't have any feeling or sensation, but I mean, for show.
yes.
So yeah, so they did the nipple sparing, and then they took the lymph nodes out at the same time to test the lymph nodes. So they had taken 10 lymph nodes of um, out of there during that surgery.
So
So
did they, I'm sorry, go ahead.
no, and then I said after that surgery, then I had the next month I had a double mastectomy.
Oh, so you had the, so wait, so what you had what surgery first? You had the nipple
The
sparing?
nipple sparing and the lymph nodes they took out to test,
Okay.
and then after about a month after that, I had the double mastectomy.
Okay, this may sound ignorant, but um, because I'm not even thinking that's how they do a nipple sparing.
Mhm.
How did they, do you remember enough to share with people like how that all happened? Because I mean, I know, did they take, okay, go ahead. I'm gonna let you explain. I'm
So he
curious.
asked me, "Did you want to keep your nipples?" I said,
Yeah.
Sure. At the time, I was like, "Yeah, I didn't, So what they do is they cut around it, and I guess take them off and then put them back on. I don't something, yeah, something like that. I mean, I don't know the
Yeah.
all ins and outs, but yeah. So I had to heal from that a little bit to before I could have the double mastectomy. So I guess you had to do that first before you couldn't do them at the same time as my understanding of it.
So they took them off,
Hmm.
they play, and then they put them back on and then did the double mastectomy, or they took them off and then
So it was just two separate
I,
surgeries. Yeah.
no, I get what you're saying, but I'm just kind
Yeah.
of like, dang, they took it off, put it back on. And I
Yeah.
guess with the double mastectomy, did they go? Because see, I got cut across, so that's why I'm
Yeah.
comprehend.
So
So
they went under, so they cut under the breast.
breast, okay, to
Yeah.
get your breast tissue out.
Yeah. Mm-hmm. Yeah.
Okay, because I was like, how make this make sense for me.
Yeah.
I was a little lost. Okay,
I
I
know. Sorry.
was like, what they do? Freeze them and then put them back
Right?
on later?
Like, we'll be back in a minute.
Like, whoa, that's different. You really got me intrigued. Okay. All right. Sorry, y'all. I had a little moment. These are the moments we have together where she's
Right?
looking at me and I'm like, what are you talking about? Okay. So then you had the double mastectomy.
Yeah,
And within that, though, I meant to ask you this question. Did you get a genetic mutation, the gene test done?
I did. Yeah. Mhm.
Okay. Were you positive for any of?
No. Mm-mm.
Oh, wow. And see,
Yeah.
that's important because a lot of people think that, oh, if you don't have a gene mutation, then you
Mhm.
shouldn't. And we know that's not true. And
Right.
given that you were stage 3, it
Hmm.
obviously was was it also fast growing? Was it a great,
Yeah.
it was a
Yeah. If I
great
didn't catch it when I did it, probably would have, traveled
benefit?
further. Yeah.
Yeah. Okay. And so they took lymph nodes out of just the cancer affected side or both
Mhm.
both
Just,
sides?
yeah, just the right side. Yeah.
Okay, so they didn't check the left. Okay, so after your mastectomy, just
Hmm.
if you can, if you don't mind, just
Yeah.
share this whole experience with everyone. How, like, just I mean, you've always talked about how you felt when you had the diagnosis and you were worried about your hair. And that was a very
Mhm.
good point to even talk about because it's not vain. It's something that you've
Yeah.
had all your life, right? And
Right. Right.
like you said, it was showing on the outside something's wrong, or it
Mhm.
feels, from other people's perspective. But share how you felt through this process and like what, anything you want to share about your journey through breast cancer and having breast cancer and going through treatment.
Well, I say that the chemo was the hardest part for sure. And like you said, I work in the prison, so I still had to go to work. I still had to, pay my mortgage, pay the bills to keep to keep my house. So it was tough because inside the prison, it's not the cleanest place sometimes. So you kind of have to, kind of be mindful of things you touch, and because your immune system is down at that time. So,
Right.
um, so yeah, and it was kind of tough. I had my coworkers supported me a whole lot because some days I go in after having chemo and I'm just not feeling it. You're tired. You're just not in the best mood. So, and I wore the little beanie hats. I didn't really like the wigs and stuff. So, because it was really hot, because it was like during the summertime.
Oh, okay.
So yeah. So other than that, and then just trying to maintain normalcy, some kind of normalcy for my daughters because they were 10 and 14 at the time and didn't really know what was going on. They didn't want mom to go anywhere. So I would go to like the field hockey games and sit out there on the bleachers, just having chemo, maybe a couple of days before that, just trying to just maintain some normalcy. So yeah, that
So
was.
just for people to understand, you were working in the prison. You
Hmm.
were going through a divorce at this time, full-fledged,
Yeah, yeah.
single parent
Hmm.
to 2 children
Yeah,
and going through all of this treatment.
yeah.
Did you have a support system?
I did because my ex-husband's family, the Thomases, amazing, amazing. So I can't say that enough. And yeah, they really stepped up. Yvette's my girl. Yvette's family slash friends. She was there. So yeah, I did have support.
Okay.
Yeah. Mhm.
What would you want mothers out there, or even fathers, because we have men
Mhm.
that have breast cancer and they may be single parents as well. What are some things that you going through this journey that you may want to share with them that may work for you? Not to say it worked for them, but something that you feel really confident in about what you may have learned through this process as a single mom.
I just try to keep them informed, like so that they didn't think that it was a scary thing. Because, at that age, they think cancer, they think, oh, mom's gonna die, or dad's gonna die, because cancer, it's seen as such like a death sentence. You know what I
Right.
mean? So, because what you see on TV all the time, so I was trying to just kind of keep them informed and let them know, hey, this is going on, this is what they got to do, and just kind of educate them a little bit so that it's not scary, so that was important to me too.
And what did you do personally for yourself?
I shopped online a lot.
Oh, okay. I mean, hey, shopping gets
It's
some
like
people
retail
through.
therapy. Retail therapy, but I really try not to, but I just tried to focus on just with the cancer, it's like baby steps, right? So you have all these stages that you got to do. You got to do chemo, surgery, radiation. I had the expanders in for about a year that I had to go get expanded to, stretch my skin so that the implants could go in. It's just baby steps. It's like conquering little goals to meet a big goal. So if you just focus on, instead of being overwhelmed, you focus on the little things and getting closer to the end, so far, the end of treatment, not the end
Right.
together, but it kind of made it a little bit easier, and it kind of, helps you along the way, because you feel like this whole thing is like, when is it going to be over, and achieving little baby steps made it easier to do that.
Oh, okay.
Yeah.
No, that's good, because you went through a lot.
Yeah, it was a
And
lot. Mm-hmm.
was it some of your treatment it wasn't during COVID? I keep on putting you in.
No, it wasn't. No, it wasn't during
I think because, and I know what it is. It's because when I met you, it was during
COVID.
COVID, and
It
I
was.
was going through my stuff, and I remember just being so fascinated about your story working in the prison and going through treatment. And so I always associate that with, oh, she was going the same time I was, but it's not.
Yeah.
Okay. So when it came to, so you had the nipple sparing, the double mastectomy, and then after that, you had another surgery because you said you had expanders.
I
So they
did.
had to take the expanders out, and then they
Mhm.
did implants, correct?
They did. Well, the plan was to do one implant, and then I was do the deep flap. The deep flap they were gonna do, which is like a deep flap is like where you get a tummy tuck. They take the skin from your stomach and put it on your breast to make the breast, to take that radiated, because that radiated skin that they did it's really tight and doesn't expand well. So what they did with a deep flap is take the skin from your stomach and put it where that radiated skin was on your breast. But the veins, like your blood vessels, have to mesh together
Mhm.
with the ones that you have up top. So that didn't go well. So the plastic surgeon just decided to put the two implants in. But when he did, he put one bigger implant than the other, because, mind you, the left side was stretched, right? So it was stretched to fit like a double D, I think it was a D cup. And
Okay.
then the radiated side was supposed to be the deep flap side, but since it didn't, the skin wasn't big enough or didn't span enough to put that bigger implant in there. So he put a smaller one. So when I came out of it, he still gave me the tummy tuck, which, I'll take it. But when I came out of it, he was like, yeah, it didn't go as planned. And I'm like, what do you mean it didn't go as planned?
Right.
So he told me what had happened, and I was like, okay, well, I'm not, obviously don't want one implant bigger than the other. It was kind of for a little while. And so I told him, I said, look, just take out the bigger one, put a smaller one in. I don't, I want to have the
Right.
same size.
Right. Yeah, I
Yeah.
could totally understand that.
So that was another surgery after that. So
Oh, wow.
yeah,
That's
yeah, like
right.
a
So you
month
put it
after.
in there. So then he probably had to let
Mhm.
you heal a little bit, and then he went back in.
Yeah, you went back in. Yeah,
Wow, Jennifer. Um, wow, that's a lot.
yeah.
So after that, were you done with surgeries though, or did you have to do any revisions, fat grafting, or anything?
No, yeah, after that I was done. So
Okay.
yeah.
So, and did he go under or over the muscle? I'm always curious about that because everybody has a
He,
different,
he went under, I believe.
okay.
Yeah. Hmm.
There is a difference. And
Yeah, there is.
yeah, some people get it over. A lot more people are getting it over now than under.
Hmm.
And under the muscle, if I recall correctly, because they tried that with me, that they cut the muscle away from the bone area,
Yeah.
and then they put it underneath.
Oh.
Yeah, it's I guess you didn't know that. Sorry. You're hurting, that's probably.
Yeah, it's good.
I mean,
They're
I'm
in,
sure
they're in there now,
they have
so
to cut some of it away, just to kind of
yeah.
put it under. So when it comes to like after you finish treatment and all of that, how what are the treatment plan, like what was your surveillance or treatment afterwards? What did that look like for you? Did they put you on like tamoxifen, or did you have to do immunotherapy? I mean, I don't know. You can share.
Yeah. So I did the depot shot for about a year where that well, I first went in to get the shot and it just cost way too much just to go get a shot.
Wow.
So I had it after that, I had it mailed to me and it was a lot cheaper. And I would give myself the shot, which was kind of new for me because I don't like needles. But to save about $900 and something, I'll shoot myself with a needle. So
Wow.
each
And what
month.
type of shot was this? Because you were what, ERPR positive?
Yeah. Mm-hmm.
Okay.
Yeah.
So it's something to block the hormone, obviously.
Exactly. Yeah. The estrogen. Yeah.
Okay. And
Yeah.
because I've never heard of that name before.
Yeah. Yeah. So after about a year, I was like, look, say the tamoxifen is doing the same thing than the shot, because with the shot, it hurts your joints a lot more. So you had a lot of side effects with your joints and stuff. So I talked to my Dr. Irvin. He's my oncologist. I talked to him. I said, hey, look, how do you feel about me stopping these shots and going on tamoxifen? Because it does the same thing.
Right.
So he was okay with that. So I went on tamoxifen in like 2019. And
Okay.
I was on that until just this past year.
So what exactly, okay, so with the shots,
Mhm.
what was the reasoning for him putting you on the shot? Was it because you had tried the tamoxifen and it was causing?
No, I never tried the tamoxifen before that.
Oh, so what was his reasoning for putting you on the shot then? What
I
was
think
the,
because they were stronger.
okay,
Yeah. Because I think my was kind of aggressive, so to be kind of a little bit more sure that
right.
the estrogen was stopping, then they were stronger.
Gotcha.
Yeah.
Okay, so this is where it gets real tricky with your story here. So you were on tamoxifen. Did he say you were going to stay on it for 5 years or 10 years?
10 years.
10 years. So that was the goal. And you started when? What year again?
2019.
2019. So you've
Mhm.
been off 2000, what, 29, I guess, right?
Yeah.
Yeah. So you say you just got off. So
Yeah.
feel free to tell the people what all you went through with tamoxifen.
So tamoxifen, some people may know, during chemo, I stopped having a menstrual cycle since 2016. Tamoxifen, that stops that. So I did not have a period since 2016.
Mhm.
So one day, I think it was August in 23, I was driving to New York to see my family, and I had bled like an actual period for like 2 days, and I haven't had that in years. At that point it was like 7 years since I've
Wow.
done that. So I knew that something wasn't right. So, and Dr. Irvin always had said, I was like, how do you know if cancer comes back? How do you know? He's like, your body will tell you. And I always thought, like, well, what do you mean? So
Right.
this is my body telling me that something was wrong. So I had called him, his office, and they said, you need to come in. Well, not first off, I went to the gynecologist. That's who I went to first. And
Mhm.
the gynecologist did their exam and everything, and they noted, I had some polyps, some endometri. Let's see. Sorry,
Well, she has to get out her handy
I had
dandy.
to get out my handy dandy notebook. Let's see. Wait, hold on. Endometrial polyps. That's what it is.
Okay.
Right? So I had to have surgery again to get the polyps out. So they took the polyps out and they tested them, and they came back cancerous. They were called. Let's see.
Look, she got the name for everything, y'all.
I do. I had to. It's endenosarcoma don't
It's
and
okay. Just do your best.
all right. Adenosarcoma. It's rare. It's a rare cancer, pretty much.
Mhm.
So it was 2% chance of getting that. 2%. And the reason the 2% is from the tamoxifen.
Mm.
So Yeah. So the tamoxifen caused the cancer in my uterus. And
Wow.
my daughter had said, Mom, why did they put you on a medicine that will cause you to get cancer back? I said, well, 98% of the time, it doesn't. So 2% of the time, and who gets it? Jen gets it. So yay. So yeah. So of course from that, um, I had a full hysterectomy. I said, just take it all out. Again, take all the parts out. I don't need them.
Mhm.
So yeah, in December, I had a full hysterectomy to get everything out again.
Wow.
Yeah.
And thank you for sharing that. And for everyone who's listening, remember, she said 98% usually does not.
Right. Does not happen. Yeah.
Once again, we're not being held for anything that we're telling
Right.
you all. I don't want people going out there and be like, oh, I can't take that no more. No, it's not to
Mhm.
say that it won't work for you.
Right.
Because you did take it. That
I
was,
did. Yeah.
and
I
I
mean,
think,
it's been on the market for how long that it's
right,
helped women, not have the cancer come back. So, proof is in the pudding. But like I said, the 2% chance, and there's always chances with everything in life, I feel.
right.
So, yeah.
Absolutely. And I think, sometimes people wonder, like, why did they do that treatment if it can
Mhm.
cause this? Because a lot of our treatment plans have really rough side effects.
Yeah.
Chemo does, the radiate, like all of it does. But I always tell people, like, when someone's coming into your house, I call like cancer to me is sort of like a thief coming in the night, basically.
Yeah.
You're going to throw everything at it you can. Like, you're not going to play fair. So for
Right.
some of us, we throw all these medicines and these drugs, whatever we can at that to try to kill it and get it out of our house, which is our
Right.
body.
Exactly.
So some people don't. Some people take another route, more holistic and nothing at
Mhm.
all. That's either way is fine, whatever you choose. But at the end of the day, always remember that I'm not going to speak for everybody, but this is what
Mhm.
I'm thinking. Most survivors and thrivers, we are doing everything that we can to fight this disease, how we feel comfortable with fighting this disease,
Right.
and how we feel led to do so. And so yeah, so that didn't work for you. Well, it
Mhm.
worked, but it just
Yeah.
had that side effect. And so how in the world now I know because I talked to you because I think we were at a walk together when you
Yeah.
because I was going through something, you were going through
Mhm.
something. And it was like, good gracious, girl, like what's we had our little talk. But how did you feel when you got those words? Like,
Mm.
okay, back, like how did that make you feel in that moment?
Because it had been about what 7 years since
Yeah.
since my first diagnosis. So they say you hit that 7 year mark, you're good to go, right? That's
Oh,
I heard
five,
that.
7, yeah.
Yeah, yeah, yeah. So at that point, I was like, well, here we go again. It's just kind of like, okay, let's get this going and get this done and over with so I can move on. So it was kind of devastating, to be honest with you, because I'd come so far and, just friends that, had to come back and it's tough. It's really tough. And to think that, why am I so, I would say fortunate, but what, why am I so like, what makes me different than any other person that hasn't come back and, you know, I don't know. I think it's called Survivor's Guilt. I think that's what it is because, yeah, but, yeah, it was kind of tough because I waited to tell my daughters and because I wanted to know exactly
Right.
what was going on and what the treatment plan was after the surgery and all that. So before I let them know what was going on. So
Yeah. And I remember hearing it in your voice. Of course, Jennifer's the type of person that will just kind of be like, yeah, but I'm still gonna, and I'm like, girl, I know this just this rocked your world, didn't it? Like it
yeah,
was, yeah. And then you kind of was like, yeah, yeah, yeah. I was like, just be like, I get it 100% how that can
yeah,
make you feel when you hear it coming, something new or something coming back.
right,
Just to hear that word. I think it's just that
yeah,
word so much with that one word that makes us anxious. And then we've
mhm,
been around so many people that have transitioned, and then you have the
right,
survivor's guilt. And go through all those things. But I'm so thankful you're here with us still.
Yes, thank you.
And you've been through a lot. You've been through a lot. So with that, they just did surgery. Did they put you back on any type of medication or any chemo, any radiation?
No, everything came back clear after the surgery, and I didn't have to have any more surgeries. I didn't have to have any more chemo or anything like that. So,
Okay.
and they, of course, as soon as they find out about this, they took me off the tamoxifen like that same day. So, and I had to go back to see Dr. Urban, who has been my oncologist since 2016, and I tell people he sat down and he was like, "Well, you don't need me anymore." And I said, don't ever say that. I said, you saved my life. You know what I mean? Like, I felt like I was breaking up with somebody, you know? He was like, well, you don't got to see me anymore. I said, well, okay.
So
You
you're
know?
not on any type of hormone blockers or anything anymore. So
No.
you just go back every year for scans or
Right. Well, this year I have 3 CT scans. So I did one in April, and I think I'm due for another one coming up. But the last scan came back clear, just to make sure that everything stays, where
yeah.
it's supposed to go. Yeah.
So do they do a PET scan on you or do they only do like a MR? What scan do they do?
A CT scan. So you go through the little machine. Yeah.
So it's just of your chest or do they do like
The
the
whole
whole
body. Yeah.
body? Okay. All
Yeah.
right. That's why I was wondering because I'm like considering, even what stage you were and everything.
Mhm.
So now you don't see your doctor. And people, let me tell you, when your doctor tells you, see you later, you don't have to come back for another year.
Mhm.
It is scary. I know it
It
was,
is. Yeah.
it's
I'm like,
like,
okay.
yeah,
Like you said, I felt like I broke up with the man, and I was like,
yeah.
I'm
It
like,
does. It feels like you broke up with him. It feels like your security blanket. And I mean,
yeah.
for some of us, we do have faith in things of that nature that we lean on, but we're human. So it's like, Dad, go on. You're not gonna watch me every
Right.
3 to 6 months. Like, what?
Mhm.
No. It's a scary feeling for
It
sure.
is.
It really is. And then you think every little lump and bump and
Mhm.
everything is like, oh, should I call him? Um,
Yeah.
so now in your life, is there anything that you want to share with anybody regarding all of this or anything that's going on in your life now? What do you have going on in your life? Anything that you want to share about even supports or anything like that? Feel free.
I guess just kind of, don't take people for granted. You know what I mean? Like, let people help you. That was a big thing for me, is letting people help. And, I've always been, oh, I got this, I'll do it, and so that was the biggest thing. And just love on people that you have in your life, because your life can change in a moment. And you're
Right.
like, oh my goodness, what's going on? So um and then as far as me, like now, like I said, I empty nester, both girls are in college, thriving, living their best life, doing what they, starting their lives, so now it's time for me to, I guess, do what I want to do. And I don't know what that is right now, but it'll come, so
It
I'm
will.
just excited to see what happens next. So
Right.
yeah.
You're such a sweet person. You are. So also, I know you had a song. I think it was Lizzo.
Yeah, Lizzo's the best, right? All of her songs. I couldn't pick just one. So she's just
So
women
what, okay,
empowerment.
what was the name of the song?
Um,
And why did you choose it?
it's called About Damn Time, right? So it's just about damn time. I mean, all this stuff's over. So it's about my time, I guess, that I can kind of do what I want to do. And I'll travel, everybody sees, well, which daughter are you going to visit this weekend, Jen? And I'm like, well, I'm going to stay my butt at home this weekend. My car be getting some miles on it.
I know, right? You got much knowledge.
Yes, but I will go in a heartbeat if they say, Mom, can you bring me this? Or Mom, I need this. I'm on that road tomorrow.
Yes, girl, you travel. I take my hat off to you because I'm like, good gracious, you'll be
Yeah.
going anywhere for anybody. I'm like, girl, you travel all, you travel a lot.
Well, I mean, it's
Such a
fun.
good,
You want
you
to take me from places. So
Yeah, you love it though. God knows you do. I'm like, I would be sleep. I would, you don't want, I'll sleep on you. I'll fall asleep.
okay.
So when it comes to leaving the audience with one word
hmm
for everyone, like a word that means maybe something to you or just a word that you like, however you want to describe it, like why, what is the word and why did you choose the word?
So the first word that came to mind, because I've been thinking about this, right, for a
Mhm.
couple of days, I would say resilience, right? So just to be like your own advocate, your own, you know your body, and just listen to it. You know what I mean? That's the main thing right there. Like a lot of people, well, I'll take care of that later. I'll do that. I got this to do, this to do, this to do. Just being resilient and being like just strong and, doing what you want to do, right? So yeah, I was trying to figure out the word that I wanted to say, but because there's a lot of words. I mean, I don't know. Um,
Yeah. Well, you're definitely resilient yourself, ma'am. I mean, you've gone through a lot and you're still here and you're still here to talk about it. And so I always leave people with something, a word or something. So I think for you is just boldness. I think you're discovering even more boldness
mhm.
and just know that your voice is heard. So for you, you're a woman of very little words, but when you speak, it's so powerful. And like you said, you're quiet sometimes, but you're observant. I
Yeah.
watch.
Oh
That's
yeah.
like
That's part of my job, honestly.
exactly. And you know
Yeah.
that I watch you because
I'm watching
you
you.
watch your watch.
Yeah.
So Jennifer has this thing, I gotta tell it. Jennifer has this thing when we go out. So Jennifer's always on the go, like we said, like she likes to travel. Jennifer always has something, washing clothes. She could be doing something else, and she loves you, but it's like time's up, it's time to go. Will
Oh
love
man.
you to death. She will break bread with you, eat with you, laugh, and she'll do just that.
No, I don't. It's my phone, not my watch.
Oh, it's your phone. She'll do that. No, one time I see you look at your watch, and I was like,
Oh
well, you
yeah.
did it again. It was the second. I
I
think
know.
when we were at the retreat and I finally said something, I was like, Jennifer, you
And I never noticed it until you pointed it out. So now I pay attention to it. And I'm like, man.
but now that's like the running joke between all of us. Now the whole world knows. But people meet me, they're gonna be like, oh, is she watching her watch?
Right. Where you going? What you doing?
But that's like
I
a
get,
running
I get
joke.
100 million things going on in this head of mine. So
Jennifer is on the go. Jennifer's a busy woman. She got kids, and at that time your kids were home. Now you didn't do it that much the other night. You really didn't. I picked on you, but
because I'm conscious of it now, ma'am. Thank you very
sorry.
much.
Sorry, I made you self-conscious.
I'm like scared to look at my watch around you or my phone. I'm like, oh crap, is she watching me? Did she see me do that? Let me do it on the down low over here.
Oh my God, we have laughed about that so much. But I love her so much. And I knew where it came from because as a parent, especially when you got kids at home and you only got a little bit of time in a day,
Yeah.
you have things to do. It's like I love y'all, but I gotta go home, go to bed, I gotta go wash my clothes. Like I get it. So it's just a joke that we have with her because she's just love her so much. But I will tell you this though, continue to speak. And I know, like you said, with your job, you observe a lot, but also you have your voice is powerful. And I just encourage you to continue to utilize your voice and continue to do it in a spirit of boldness.
Yes.
And in this season, allow Jennifer to soar and be Jennifer and just live freely. You've done so much for so many people, and this is your season
Yeah.
be about what you want to do. You still got your babies, even though they're
I
out,
know.
they're still your babies. But
Yeah.
this is Jennifer's season. You've been through a lot and you deserve it. You deserve it. So give yourself that grace and just enjoy life. Continue to enjoy life.
Thank you.
Yeah, I love you so much. Please don't beat me up
I
because
love you too.
but yeah, so is there anything else you want to share or
I just want to say thank you to everybody that kind of did help me along the way, especially in my time of need and everything. And it doesn't go unseen, and it doesn't, I will never, ever forget the people that were there and who are there, and that I just love y'all.
Oh, we love you, Jennifer.
Oh, let's do it. Ready?
Oh yeah, let's do it. I actually did it right tonight. So we're making a heart for those who are just on the podcast. We're making a heart with our hands. And the other night, Jennifer and I tried to make a heart together, and my fingers just couldn't get it right. And I was like, "Well, this is gonna look awkward, but we got to go anyway."
Yes. we look good doing it. Yes, we look good.
And this came from the organization.
Exactly.
Yeah, from Here for the Girls, we always make hearts with our hands. So
yeah.
It's our thing. But thank you so much for this time. I appreciate you.
Well, thank you for having me. I've been waiting patiently.
Yeah, you have. Yep. Yep. And I finally learned how to do somewhat of the system now. So I was like, I got to get it back in.
Yeah.
And I'll be seeing you this Saturday for the
run.
run.
Yes, for the walk. Yeah. Well, no, we're not running. We're walking. Well, I'm walking.
I'm volunteering. So
yeah. But still, we'll all be there.
Yeah, absolutely. Well, this is another episode of Our Scars Speak. And remember that your mental and your physical scars speak a story, one that we hope and pray one day you will share. But if not, there is no pressure. You don't have to. But if so, feel free, because our scars, mental and physical scars, speak a story that can help heal the wounds of another. So without further ado, this is the end of this podcast, and we love you, and we'll see you again next week. Bye.